But from our perspective, particularly because we do have a lot of complex cases and a lot of high-risk situations where folks have had a number of previous head injuries and they're going back to potentially high-risk sport like football, we want to have sensitive tools that if we're seeing that some things appear to still be off, we can give them some extra time to fully recover. And in those cases, again, anecdotally in some of our early clinical research that we're doing here, we're seeing that these things are normalizing. It's just taking a little bit longer. And we know that the proximity factor is a big deal in head injuries and long-term issues. So if folks have head injuries with low proximity, back-to-back, so to speak, then they're going to have more problems down the road. So it makes a lot of sense to utilize tools, particularly in high-risk athletes, to really try to space out the proximity factor or the risk factor that they have if they're not fully recovered. Those head injuries that tend to be closer in proximity can result in more long-term issues. So if we have some tools that can help reduce the risk of that, help us really figure out, are they really truly fully recovered, or are they still maybe in the healing window, even if it's 95%, even if they feel good, the brain hasn't really gotten back to that equilibrium yet, and space it out a little bit further. So if there is another head injury coming down the road, at least the proximity isn't so close, because the closer the proximity of head injuries, the more problems that folks are going to have down the road.